Hello everyone, let's see an important topic of oral surgery, Ludwig's angina. So it is a firm, acute, toxic cellulitis causing bilateral swelling of submandibular, submental and sublingual spaces. Cellulitis means basically inflammation of the soft tissue. So what can be its causes? Dental infection, for example, any periapical infection in mandibular molars, submandibular gland sialadenitis, compound mandibular fracture, puncture wounds of floor of mouth, osteomyelitis, and secondary infection of oral malignancy. Now let's understand this diagram. In the center there is geniohyoid, and on the sides, that is on the lingual side, there will be sublingual space above the mylohyoid. Below the mylohyoid, there will be submandibular space. So submandibular space is below the mylohyoid muscle between the anterior belly of digastric and the posterior belly of digastric. Now let's understand the pathogenesis. For example, there is a mandibular molar infection of this side. The infection will first spread to the submandibular space of the same side. From the submandibular space, the infection will get spread to the sublingual space on the same side. Then it will cross and infection will spread to the contralateral side of the sublingual space. Then the infection will be in the submandibular space. So all four spaces will get involved. Now how submental space will be infected? By the lymphatic drainage. Now let's read it. Mandibular molar infection. This will spread to the submandibular space on the affected side. How? Through the posterior border of mylohyoid muscle. Then ipsilateral sublingual space will be involved. It will cross to the contralateral side and spread by the loose areolar tissue. So now contralateral sublingual space is involved. That is now submandibular, sublingual, and the contralateral sublingual space is also involved. Now bilateral submandibular space is involved. Now if it is not treated, then it will go to the masticatory spaces, that is pterygomandibular spaces, then to pharyngeal spaces, and finally to mediastinum. And lymphatic drainage will cause the submental space involvement. Now let's see the microorganism. The most important is alpha hemolytic streptococci. It has hyaluronidase and lactic acid, which causes the rapid spread of infection. Now there are 5 important hallmarks of Ludwig's angina. So first one is brownie edema. Brownie means woody hard. So it spreads rapidly and it is not fluctuant and it is tendon. Now let's see the second point. There will be elevated tongue. The bilateral sublingual infection plus edema will spread to the musculature of the tongue. So there will be upward and backward falling of the tongue. So what will this cause? This will cause difficulty in mastication, speech and swallowing. Then there will be airway obstruction because of the obvious upward and backward falling of the tongue. There will also be edema of the glottis, hoarseness of voice, stridor and choking. That is basically angina. There will be paucity of pus and there will be toxic nature of this infection. That is, there will be fever, dehydration and septicemia. Now how will we manage it? First, we have to do early diagnosis, as we can see that there is airway obstruction and stridor. So early diagnosis is very important. Then we have to do the airway maintenance. Tracheostomy is mostly preferred, but fiber optic laryngoscopy and cricothyroidectomy can also be done. Then prolonged IV antibiotics have to be given, penicillin and metronidazole for 5 to 7 days, and then we can shift to oral antibiotics. Hydration, parenteral fluids, especially Ringer's lactate. So early incision and drainage. So first, earlier it was done cut throat incision, that is incision was made on the lower border of mandible and hyoid bone. So between the lower border of mandible and hyoid bone, an incision was made from one angle to the another angle, but the disadvantage was that there will be a big scar formation. So now what method is used? Hilton's method of abscess drainage. So 2 stab incisions in the submandibular space and 1 stab incision in submental space, and through this curved hemostat is inserted and to dissect blindly. The loculi are broken down and the pus is drained. Why we are doing this? Our main objective is to release the pressure within this edematous tissue. If the pus is present, we will send it for culture. And for sublingual space, we will do same Hilton's method but through an intraoral approach. The incision will be made through the close to the base of the alveolar ridge of mandible. And if the fluid is present, then a drain, that is a rubber drain, will be secured in the incision and sutured. And this drain is kept for 48 hours, not more than that. Then the extraction of the affected tooth. The extraction tooth has to be removed either at the time of the incision and drainage, or if the mouth opening is less than 2 to 3 days after incision and drainage. Hopefully you found this video helpful, and if you found it helpful, please like and subscribe. Thank you.